Welcome back to It's Your Case, presented by VetCT.com. I'm Heather, your radiologist on demand for this week. Today's case is a 14-year-old male Shih Tzu with progressive lethargy, hyporexia for 2 weeks, and now increased respiratory rate with shallow breathing. Once you've reviewed the radiographs, then you're ready to watch this video. So we've been talking about lung patterns over the last couple weeks, and this is actually a kind of special example that I wanted to bring to everyone's attention. I think when we first opened the case, we can all agree about a few things. One, there's an overall increased opacity in the thorax, and it's maybe not uniform. In the caudodorsal lung fields on this view, I can trace the pulmonary blood vessels, for example, here. Whereas when I look more cranially, I don't see the pulmonary blood vessels as well. I'm going to go to one of the lateral views next. Let's use the left lateral view to look a little more closely. When I'm looking at lungs, once I've decided that there's increased opacity, as I've mentioned, one of the next things I do is try to tell whether I can see pulmonary blood vessels. We saw some in the caudodorsal lung field. I don't see any pulmonary blood vessels here in the cranioventral lung field. When I get really close in here, what I'm starting to see is an appearance that I would call sort of stippled. Do you see how there's interdigitating soft tissue and gas opacity, and it almost has like a sponge-like or a dot appearance? I often describe this as stippled, and this is a special lung pattern conclusion for me. I tend to call this a vesicular lung pattern. A vesicular lung pattern is something that is characterized by not only inability to see the pulmonary blood vessels, but this interdigitation or sort of stippled appearance. Of course, when I see something on one view, I like to look for it on the other view. So let's go back to our VD. We focused a little bit on the caudodorsal lung field, but when we zoom in here cranioventrally, and maybe I'll just window a slight amount too, you can probably appreciate that we still have that stippled appearance here in this right cranial lung lobe. I also think that this part of the lung on the left cranial lung field area has increased opacity as well, and I would characterize that as more of an interstitial pattern. There's quite a lot of pleural fluid here, for those of you that aren't used to looking for it. Here's what I see as soft tissue or fluid opacity that's displacing the lung from the thoracic wall. Other signs of pleural fluid that are present here, for me, it is very difficult to see the cardiac silhouette. On all of the views, here's our lateral view again. The heart margins are hard to see. This is that concept of border effacement where we have the pleural fluid, which is of fluid or soft tissue opacity, contacting the cardiac margins, and in this case, contacting the diaphragmatic margins too, making their distinction quite difficult, and we call that silhouetting or border effacement. So when we look at the lung, we don't see pulmonary blood vessels, we don't see specific lines and rings, we have this unique stippled or vesicular pattern present. Next thing I want to then think about, what's the distribution? Well, for the vesicular pattern, I would argue that the distribution is quite specific to the right cranial lung lobe, although I think we can agree that there's increased opacity elsewhere, especially here on the left, which is probably more characterized as an interstitial pattern. When I have a lobar distribution of a vesicular lung pattern, that is a very specific finding for me that always makes me think first and foremost about lung lobe torsion. The literature on lung lobe torsion would reflect that these dogs often have a lobar sort of sign where there's one lung lobe that's especially more abnormal. They virtually always have pleural fluid, and this vesicular pattern has been linked to vesicular emphysema present in the lung histologically. This is the equivalent of some sort of enlargement of the air spaces within the lung, but in a manner that's disorganized because of lung necrosis. Because it's a finding probably more pathognomonic for lung necrosis than specific to lung lobe torsion being the most common cause of lung necrosis in the dog, I usually jump to lung lobe torsion as the most likely differential, but probably this pattern is created by the necrosis more so by the torsion if we're really being specific about it. Virtually all the papers on lung lobe torsion, which I've listed for you in the report, do mention this pattern along with pleural fluid. The site of lung lobe torsion can vary a little bit. There are trends towards larger dogs having this more likely in the right middle lung lobe. Some smaller dogs may have this in the left cranial lung. There are, in terms of the interstitial pattern, there are reasons for this dog to have hypoinflation atelectasis because of the pleural fluid. So, although I wouldn't want to fully exclude, especially in a 14-year-old dog, that the lung lobe torsion could be secondary to some pre-existing underlying lung pathology, I think it's possible that this additional pulmonary opacity that we're seeing is just incidental hypoinflation or atelectasis. The literature would support that it's less common. Lung lobe torsion is usually not associated with pre-existing lung disease, but it certainly can be. So here's another example where we can see the lesion. We use our radiographic findings and especially knowledge of this special vesicular lung pattern and the distribution of it being in one lung lobe to kind of help us get to a fairly specific diagnosis. Be sure to review the full report associated with this case and join us next week for further examples. Thanks for listening, and remember, it's your case, so please post your questions on social media.